Imagine walking down a dusty country road, and right beside the ditch, growing between gravel and weeds, is a plant that doctors once prescribed for pain. Not a rare rainforest herb, not a secret laboratory drug. Just a tall, bitter plant that grows wild across North America and Europe. For centuries, physicians used it to calm coughs, ease pain, and help people sleep. Ancient medical texts described it. Civil War surgeons used it when morphine ran out. Pharmacies once sold it in bottles across America, and then, almost overnight in historical terms, it disappeared from medicine. Today, most people walk past it without ever realizing what it is. Before we dive in, tell me in the comments, where in the world are you watching from? And what's the one crop you wish you could grow easily in your garden this year? Because in this video, you're going to discover something fascinating. You'll learn the real story of a plant called wild lettuce, a tall roadside weed once nicknamed lettuce opium. We'll talk about its long history, what scientists actually know about its effects, why it faded from mainstream medicine, and how people today still recognize it growing in the wild. And toward the end, I'll show you something even more surprising. The simple reason a plant used for over 2,000 years could vanish from modern medical practice in less than a century. But let's begin much earlier. Long before modern pharmacies, long before synthetic drugs, back when medicine came directly from fields and forests, because the story of wild lettuce begins thousands of years ago. Some historians trace its use all the way back to ancient Egypt. One of the oldest known medical documents, the Ebers Papyrus, written around 1550 BCE, described medicinal plants used to ease pain and bring sleep. Among them was a type of lettuce known for producing a milky sap, used for 2,000 years, erased in. Later, Greek physician Dioscorides, writing in the 1st century, described a plant called Lactuca virosa, sometimes translated as bitter lettuce. The name itself hints at its strange feature: cut the stem, and a white latex sap slowly bleeds out. That sap, when dried, forms a brown resin called lactucarium. For centuries, herbal physicians believed this substance had calming and mild pain-relieving effects. But here's something important to understand right away. Wild lettuce is not a replacement for modern medical care, and its effects are usually considered much weaker than pharmaceutical painkillers. Researchers today still study compounds in the plant, but evidence for many traditional uses remains limited or inconsistent. So why did earlier physicians value it? To answer that, we have to jump forward in time to one of the most brutal chapters in American history, the Civil War, and what desperate battlefield surgeons discovered growing right outside their tents. Picture a battlefield hospital in the 1860s. No electricity, no sterile operating rooms, rows of wounded soldiers waiting for treatment. In the early years of the American Civil War, morphine and opium were the primary pain relief medicines available to surgeons, but supplies didn't always last. Union forces issued massive amounts of opium-based medicines to soldiers, millions of pills and powders during the war. But Confederate medical supplies were often cut off by blockades, leaving field hospitals dangerously short of anesthesia. Used for 2,000 years, erased in. When those supplies ran out, surgeons sometimes had to look for alternatives, and one of the plants growing wild across the countryside was wild lettuce. Historical accounts describe doctors harvesting the plant, collecting its milky latex, and drying it into the resin called lactucarium. The effect was far milder than morphine, but in desperate conditions it could help dull pain and calm coughing fits. Used for 2,000 years, erased in. It wasn't magic, it wasn't perfect, but it was something, and that mattered. After the war, physicians began paying closer attention to alternatives to opium. The reason was simple and tragic. Opioid addiction was already becoming a serious problem. By the late 1800s, addiction to opiates, often called soldier's disease, affected large numbers of veterans. Medical journals of the time began discussing safer or milder remedies. Wild lettuce became one of them. In the late 19th century, physicians in Europe, including doctors in Poland, compared preparations made from lactucarium with opium-based medicines for treating cough, mild pain, and insomnia. Some reports suggested the plant's effects were weaker, but produced fewer severe side effects. Used for 2,000 years, erased in. Because of this, wild lettuce eventually made its way into official medical references. By the late 1800s, the U.S. Pharmacopoeia, the official list of recognized medicines, included preparations made from the plant. It was also listed in early British pharmaceutical guides as a mild sedative used in syrups and lozenges for cough and sleep problems. Used for 2,000 years, erased in. So at the time, this wasn't fringe herbalism. It was simply one tool among many in a doctor's cabinet. But something enormous was about to change medicine forever. In the early 20th century, science entered what many historians call the golden age of pharmaceuticals. Synthetic drugs were emerging. Laboratories were learning how to isolate molecules, modify them, and manufacture them at scale. Aspirin had already been synthesized in the late 1800s. Soon came barbiturates, antibiotics, and eventually the modern painkillers we recognize today. And this shift from plants to chemistry would quietly push many traditional remedies, including wild lettuce, out of mainstream medicine. Stick with me, because in the next part, we're going to explore exactly why a plant used for thousands of years suddenly disappeared from pharmacies, and why scientists today are still studying the compounds inside it. By the early 1900s, medicine was changing faster than it ever had in human history. For thousands of years, most remedies came from plants, minerals, and animal products. Physicians mixed extracts, tinctures, and powders based on traditional knowledge and experience. But then, chemistry arrived. Scientists began isolating individual compounds inside plants and studying exactly how they worked inside the body. Instead of using willow bark tea for pain, chemists produced acetyl salicylic acid, which the world now knows as aspirin. Instead of crude plant extracts, laboratories began creating precise synthetic molecules, and that shift changed everything. Because once a compound can be isolated, standardized, and manufactured in large quantities, it can also be patented, regulated, and distributed through pharmaceutical companies. Plants like wild lettuce didn't fit easily into that new system. The active substances believed to contribute to its effects, compounds such as lactucin and lactucopicrin, occur naturally in the plant's latex. Researchers have studied these chemicals and found that they may influence certain nerve signaling pathways in animals. For example, laboratory studies have shown these compounds may interact with the nervous system and could have mild sedative or analgesic properties in experimental settings. But here's the key point. Results from laboratory or animal studies do not automatically translate into proven medical treatments for humans. Modern medicine requires large clinical trials to confirm safety and effectiveness, and those trials are extremely expensive. By the mid-20th century, keeping a medicine listed in official pharmacopoeias required rigorous testing, standardization, and regulatory approval. That kind of research costs millions of dollars. And there was one big problem. You can't patent a wild plant that grows along roadsides. Without a patent, pharmaceutical companies had little financial incentive to invest in large clinical trials for wild lettuce extracts. Meanwhile, synthetic painkillers were advancing rapidly. Drugs like acetaminophen, ibuprofen, and other modern analgesics were easier to standardize, manufacture, and regulate. So gradually, older botanical medicines began disappearing from official medical lists. Wild lettuce was one of them. By the mid-1900s, it had largely fallen out of conventional medical use, not necessarily because it was proven ineffective in every context, but because medicine had moved towards standardized pharmaceutical drugs. And once medical schools stopped teaching about it, a generation of doctors simply grew up never hearing its name. But here's something fascinating. The plant itself never disappeared. It was still growing everywhere, along fence lines, in abandoned lots, on the edges of farm fields, quietly waiting for anyone who knew how to recognize it. Now, before we go any further, we need to talk about something extremely important. Wild lettuce is often described online as a natural painkiller. But many of the claims circulating on the internet today are exaggerated or poorly supported by scientific evidence. Modern research has confirmed that compounds in wild lettuce can influence certain biological pathways in laboratory studies. Some experiments in animals suggest mild pain-relieving or sedative effects. However, there is no strong clinical evidence proving it works as a reliable treatment for pain or insomnia in humans. And like many wild plants, it also comes with potential risks. Some species of wild lettuce can cause side effects if used improperly. Reports have described symptoms such as nausea, dizziness, sweating, or allergic reactions when large amounts were consumed. In rare cases, misidentification of plants can also be dangerous, especially for people who are new to foraging. So if you ever explore medicinal plants, the safest rule is simple. Never treat them as substitutes for professional medical care, and always consult qualified experts before using any plant medicinally. But even with those cautions, the story of wild lettuce is still fascinating because it shows how knowledge about plants can rise, fall, and sometimes disappear. And interestingly, interest in this plant didn't stay buried forever. In the 1970s, curiosity about wild lettuce began to reappear in an unexpected place, not in hospitals, not in pharmaceutical laboratories, but among herbalists, foragers, and people exploring traditional plant knowledge. Old herbal books described the plant, foraging guides mentioned its distinctive milky sap, and slowly people started asking the same question again. What exactly is growing out there in the weeds? In the next part, we're going to look closely at the plant itself, because if you walked past wild lettuce tomorrow, there's a good chance you wouldn't recognize it. And yet, once you learn its features, you'll start seeing it everywhere. Now, let's step out of the history books for a moment and into the real world. Because the strange thing about wild lettuce is that it isn't rare. In fact, once you learn how to recognize it, you may start noticing it almost everywhere. It grows along roadsides, at the edges of gardens, in vacant lots, pastures, and disturbed soil. Sometimes it appears exactly where gardeners don't want it, pushing up through gravel or cracked earth where almost nothing else grows. The species most commonly discussed in historical herbal medicine is Lactuca virosa, sometimes called bitter lettuce or wild lettuce. But here's an important warning right away. Several different wild lettuce species exist, including Lactuca serriola, sometimes called prickly lettuce. These plants look very similar, and people often confuse them. While both contain related compounds, they are not identical, and correct identification can be difficult for beginners. If someone is learning about wild plants, it's always safest to study with experienced botanists, field guides, or local experts before attempting identification. With that said, wild lettuce has a few distinctive features that help experienced foragers recognize it. The plant can grow surprisingly tall, often 3 to 6 feet high in good conditions. Its stem is upright and sometimes shows purple spots or streaks. The leaves are long and jagged, and on some species you'll notice something unusual. Along the underside of the central leaf vein, tiny spines run like a thin line of teeth. But the most famous characteristic appears when the stem is cut. A white, milky sap slowly oozes out. This latex is what historical herbal texts described as the source of lactucarium. As the plant matures, it produces small yellow flowers that resemble miniature dandelions. After flowering, the plant releases fluffy seeds that drift away on the wind. That ability to spread easily is one reason wild lettuce appears in so many places. It's what botanists call a pioneer plant, a species that quickly colonizes disturbed soil. Construction sites, road shoulders, riverbanks, abandoned farmland, places where nature is slowly reclaiming the land. And in many of those places, the plant grows completely unnoticed. But here's the interesting part. For most of human history, people paid much closer attention to plants like this. Grandparents knew which weeds were edible, which were medicinal, and which ones to leave alone. That knowledge passed quietly from one generation to the next, and when those generations disappeared, a lot of that knowledge faded with them. Today, a person might mow over wild lettuce without ever realizing that earlier generations once considered it valuable enough to sell in pharmacies. But the plant itself hasn't changed. It still grows, still flowers, still produces that strange, milky sap. And in recent decades, scientists have started looking at it again. In the early 2000s, researchers began revisiting several plants that had once been used in traditional medicine. Wild lettuce was one of them. Scientists isolated compounds from the plant, particularly lactucin and lactucopicrin, and studied how they behaved in laboratory experiments. Some studies in animals suggested these compounds might have mild sedative or analgesic effects. For example, experiments involving mice showed certain doses produced pain-relieving responses comparable to common anti-inflammatory drugs in that specific experimental model, used for 2,000 years, erased in. But again, it's important to keep perspective. Animal studies are early-stage research. They help scientists understand possible biological mechanisms, but they do not prove effectiveness in humans. What these studies did confirm is that wild lettuce contains compounds capable of interacting with the nervous system. Researchers have also examined how these substances interact with adenosine receptors, which play roles in sleep regulation and neural signaling. Interestingly, some laboratory research has also explored how certain compounds from the plant may influence enzymes involved in neurological processes. Used for 2,000 years, erased in. However, this does not mean wild lettuce is a treatment for neurological diseases. Those ideas remain speculative and require far more research. So today, the plant sits in an unusual position. It's not part of modern mainstream medicine, but it also hasn't been forgotten entirely. You can find wild lettuce extracts, tinctures, and capsules sold online and in some herbal stores. Prices vary widely, and quality can differ significantly. Unlike pharmaceutical drugs, many herbal supplements are not standardized, meaning the concentration of active compounds can vary greatly between products. And in some cases, products labeled wild lettuce may actually contain different species or very small amounts of the plant. That uncertainty is one reason modern medical systems rely heavily on regulated pharmaceutical products. Consistency matters when treating health conditions. But even with those challenges, the story of wild lettuce raises an interesting question. How many plants once known to our ancestors are now simply ignored? How many useful species grow quietly along fences, fields, and forgotten corners of land? In the next part, we'll look at why knowledge about plants like this sometimes disappears, and why gardeners and homesteaders are starting to rediscover it. And I'll show you something surprising about how modern pharmaceutical medicine still depends heavily on plants, even today. Here's something many people don't realize. Even though modern medicine often feels completely separate from nature, plants are still deeply woven into it. Researchers estimate that roughly a quarter of modern pharmaceutical drugs originate from plant compounds or were inspired by them, used for 2,000 years, erased in. Some of the most famous medicines in history began as simple plant remedies. Aspirin traces its origin back to willow bark, which people used for pain relief for centuries. Morphine comes from the opium poppy. The heart drug digoxin comes from foxglove. Even some cancer treatments were discovered in plants growing quietly in forests. In other words, modern pharmacology didn't replace plants. It studied them, isolated their active compounds, and transformed them into standardized medicines. That process brought enormous benefits: precise dosing, consistent quality, large clinical trials that prove safety and effectiveness. But it also changed the way people think about plants. Instead of seeing a living plant as medicine, scientists began focusing on specific molecules inside those plants. Once a compound was isolated and synthesized, the original plant sometimes faded from attention. Wild lettuce is one example of that shift. Once physicians stopped prescribing it and pharmaceutical companies focused on synthetic pain relievers, the plant slowly slipped out of public awareness. Medical schools stopped teaching about it. Pharmacies stopped stocking it, and over time, even gardeners forgot its story. Yet if you walk along the edges of farmland or along abandoned roads today, the plant is still there, growing exactly the way it has for centuries. That's something fascinating about nature. Human systems change, industries change, medical trends change, but plants simply keep growing. And sometimes knowledge waits quietly for someone curious enough to rediscover it. Now here's where the story becomes especially interesting for gardeners and homesteaders, because wild lettuce isn't just a historical curiosity. It's also an example of something much bigger, a category of plants often called forgotten weeds. Plants that grow easily, survive tough conditions, and often require almost no care. Some are edible, some have traditional medicinal uses, others improve soil or attract beneficial insects. For most of history, people paid close attention to these plants because they were part of everyday survival. A farmer might grow crops intentionally, but they also recognized useful plants growing naturally around the edges of fields. This kind of practical knowledge was especially important during difficult times, during wars, economic depressions, crop failures. When supply chains failed, people often turned back to local plants they already knew. Today, we live in a very different world. Food travels thousands of miles. Medicine is produced in specialized laboratories. Most people rely entirely on stores and pharmacies. But the last few years have reminded many people of something our grandparents understood well. Supply systems can be fragile, and when disruptions happen, whether from weather, economics, or global events, local knowledge suddenly becomes valuable again. That's one reason survival gardening, foraging, and perennial crops are becoming popular again. People aren't trying to replace modern medicine or agriculture, but they are interested in relearning the basics: which plants grow naturally in their region, which weeds are edible, which perennials can produce food year after year with little work, and which forgotten plants have interesting historical uses. Wild lettuce sits right at the center of that rediscovery, not as a miracle cure, not as a secret drug, but as a reminder that the natural world around us still holds a huge library of knowledge, if we take the time to notice it. And that brings us to the final part of this story. Because the real lesson of wild lettuce isn't just about one plant. It's about something much bigger, something anyone can start doing today. So what's the real lesson hidden inside the story of wild lettuce? It's not that modern medicine is wrong, and it's not that every wild plant is secretly a powerful cure. The truth is more interesting than that. For most of human history, people lived much closer to the plants around them. They recognized dozens, sometimes hundreds, of useful species growing naturally in their environment. Some plants were food, some were fiber, some were medicine, some were simply signs of soil health or seasonal change. But as the modern world developed, much of that everyday knowledge slowly faded. Today, many people can identify dozens of corporate brands, but struggle to name even 5 plants growing in their own neighborhood. And that's where wild lettuce becomes symbolic, because this plant never vanished. It didn't go extinct. It wasn't banned. It wasn't wiped out. It simply stopped being noticed. Medical systems moved toward standardized pharmaceuticals. Universities focused on laboratory chemistry, and the practical field knowledge once passed between herbalists, farmers, and pharmacists slowly drifted into the background. But over the past 2 decades, something interesting has started happening. Scientists have renewed interest in ethnobotany, the study of how different cultures traditionally used plants. Researchers are re-examining historical herbal texts, old pharmacopoeias, and indigenous plant knowledge. Sometimes they discover that traditional remedies contain compounds worth studying further. Other times, they confirm that some historical uses were exaggerated or misunderstood. Both outcomes are valuable because the goal isn't to romanticize the past. The goal is to understand the natural world more deeply. And plants like wild lettuce remind us that the line between weed and resource often depends entirely on knowledge. One person sees a nuisance, another person sees a plant with an interesting history stretching back thousands of years. The plant hasn't changed, only our awareness has. And that's something gardeners understand better than anyone. Spend enough time growing food, watching soil, observing insects and seasons, and eventually you realize something simple. Nature is constantly offering information. Most of us just forgot how to read it. So here's the part of the story I promised at the beginning. The reason a plant used for more than 2,000 years could quietly disappear from medicine in less than a century. It wasn't necessarily because the plant stopped working, and it wasn't because someone banned it. The real reason is simpler. The world changed. Medicine became more scientific, more standardized, and more tightly regulated. Pharmaceutical companies focused on compounds that could be manufactured consistently and tested through large clinical trials. That shift saved millions of lives. Antibiotics, vaccines, and modern surgical medicine transformed human health. But at the same time, some older botanical remedies gradually faded from everyday awareness. Wild lettuce was one of them, yet the plant still grows. Along fences in Europe, beside roads in North America, in empty lots, pastures, and forgotten fields. It grows quietly, year after year, whether people notice it or not. And that's the deeper message behind this story. Nature is still full of knowledge. Plants that improve soil, perennials that feed families for decades, wild greens hiding in lawns, ancient crops that survive drought, heat, and neglect. Many of them were once common knowledge. Then modern life got busy, and people stopped looking down at the ground. But the good news is this: that knowledge isn't gone. It's just waiting to be rediscovered. So here's a simple challenge you can try today. The next time you walk outside, whether it's your backyard, a roadside path, or a quiet field, look carefully at the plants around you. Instead of seeing weeds, start asking questions. What is that plant? Where did it come from? What did people once use it for? You might be surprised how many forgotten stories are growing right under your feet. And if you want to keep rediscovering plants like this, forgotten crops, edible weeds, survival garden plants, and ancient gardening wisdom, make sure you subscribe. Also tell me in the comments, which country are you watching from? And what's one wild plant you've seen growing near your home? Your answer might help someone else notice something they've been walking past for years. And if you'd like, I can also make a video about 10 edible weeds hiding in your lawn that people once relied on during hard times. Just comment "weeds" below if you want to see that next. Until then, remember this: sometimes the most overlooked plants carry the longest stories.